All right, let's talk about something kind of crazy. What if I told you that a super common physical therapy treatment, something top athletes and probably even people you know have had, could actually lead to a collapsed lung? No, I'm not making this up. It literally happened to NFL star TJ Watt. So, today on my channel, we're going to dig into the hidden risks of dry needling and, most importantly, how you can stay safe. I mean, that's a pretty shocking question, right? But it's the exact question that started flying around after the Pittsburgh Steelers' own TJ Watt went through this. So we're going to get into the real story behind the headlines. What even is dry needling? What are the actual risks? And what do you need to look out for? If this is the kind of stuff you're into, do me a favor and hit that like, share, and subscribe button so you don't miss out on our next explainer. Okay, so here's our game plan for today. First, we'll get into that NFL story that got everybody talking. Then, we'll figure out what dry needling really is. We'll check out the safety rules, look at the real risks, and wrap it all up with a guide to make sure you're in control of your treatment. Let's do this. You know, it's not every day that a physical therapy method ends up on ESPN, but this story was just too big to ignore. Honestly, it's the whole reason we're even talking about this today. So here's the deal. TJ Watt, an absolute beast on the football field, had to get treated for a collapsed lung. The official term is pneumothorax. And pretty soon, reports started linking it back to a dry needling session he had. Now, it's super important to say that nobody was accusing anyone of doing anything wrong, but you can bet the story put a huge spotlight on this really serious, even though it's super rare, risk that most of us had never even heard about before. Okay, so now we know why this is suddenly a hot topic. Let's get into what dry needling actually is. Because honestly, there's a lot of confusion out there, so let's clear it all up. So at its heart, dry needling is a technique that trained pros, like physical therapists, use for muscle pain. They take these super thin, sterile needles and go after trigger points. You know exactly what I'm talking about, those awful, tight, painful knots in your muscles that just refuse to chill out. And the dry part? It just means they're not injecting anything. The whole point is to get that muscle to release, which hopefully means less pain and better movement for you. Okay, this is where a lot of people get mixed up, so let's set the record straight. Yeah, they both use thin needles, but dry needling and acupuncture are totally different beasts. Think of it like this. Dry needling is based on Western medicine. It's all about anatomy, finding a specific muscle knot and getting it to release. Acupuncture comes from traditional Chinese medicine, and it's focused on balancing your body's energy flow, or qi, along pathways they call meridians. So yeah, two very different philosophies, two very different goals. So who's this for? Well, you'd be surprised. It's for a huge range of people. We're talking everyone from pro athletes pushing their bodies to the limit to maybe you sitting at a desk all day with that nagging neck pain. Basically, if you've got painful muscle knots and tension, you could be a candidate. It's used for all sorts of people of all ages, usually as one part of a bigger physical therapy plan. Okay, so anytime a procedure involves needles piercing your skin, you'd hope there are some seriously strict safety rules, right? Of course. So let's take a look at how this stuff is regulated and what a truly safe professional setup is supposed to look like. And listen, the safety rules we're about to go over, these aren't just, friendly suggestions. They come from official health authorities, like the ones you see here from the Saudi Ministry of Health. These are the rule books. They set the absolute non-negotiable standards for things like hygiene and patient safety that every single person doing this procedure has to follow. It's all about protecting you. And it all starts with the basics, but like the basics on steroids. Hand hygiene is everything. We're talking about a super detailed, multi-step process that's designed to get rid of any risk of infection. This is not your quick, splash-and-go hand wash. It's basically a medical procedure all on its own. Think of this as your personal checklist for what a pro setup should look like when you walk in. You absolutely need to see sterile single-use needles. They should have gloves, cotton, and, this is a big one, special containers for all the waste, especially that yellow Schupp's container for used needles. Seriously, if the room doesn't look this organized and clean, that is a huge red flag, period. All right, let's get to the million-dollar question, the one that TJ Watt's story really brought into the spotlight. What can actually go wrong here? And, just as important, how likely is it to happen? It's time to separate the real facts from the fear. So potential side effects are kind of on a spectrum. On one end, you have the really common stuff. The vast majority of things are mild and don't last long. A little bit of bleeding, maybe some bruising, or feeling sore afterwards, that's totally normal. It's just your muscle reacting, and it usually goes away pretty fast. But then, on the other end of the spectrum, you have more serious things, like fainting. And then the most serious of all, that pneumothorax we talked about. So what exactly is a pneumothorax, or a collapsed lung?
Well, imagine there's a space between your lung and your chest wall. A pneumothorax happens when air gets into that space. That air then pushes on your lung and causes it to collapse. With dry needling, it's a risk that comes down to pure anatomy. If a needle goes too deep in a spot where the lung is right underneath, like your upper back or near your collarbone, it could accidentally puncture it. The signs are usually pretty immediate and hard to miss. A sudden, sharp pain in your chest and feeling like you can't get enough air.
But now, check this out, because this number is maybe the most important one to remember. Yes, a collapsed lung is super serious, but it is unbelievably rare. We are talking about an estimated chance of less than 0.01 for every 10,000 treatments. That is a tiny, tiny fraction of a percent. So while it's definitely a known risk that practitioners are trained to avoid, it is not something that happens often, not by a long shot. Okay, so with all that said, the most important thing is knowing how you can protect yourself, right? This last section is basically your personal playbook. It's all about giving you the tools you need to be an active, informed, and empowered patient. First things first, this treatment is not for everybody. I mean, if you have a serious phobia of needles, this is probably a no-go. But more importantly, some medical conditions just make it too risky. We're talking about anyone with a bleeding disorder, or people on blood thinners, or if your immune system is compromised. Also, a ton of caution is needed for pregnant women. Any good therapist is going to ask you about all of this stuff before they even get started. Which really brings us to the biggest question of all. How do you find someone qualified, someone you can actually trust? Because when it comes right down to it, the safety of this whole thing really depends on the skill and the knowledge of the person with a needle in their hand. Here is your power move. This is how you take control. Do not be shy about interviewing your therapist. Ask them straight up, are you licensed? What specific training do you have for this? How often do you actually do this procedure? And here's a huge one. What are the specific risks for the exact spot on my body you're going to treat? They should also take the time to go through the consent form with you, step by step, making sure you get it. And this quote right here, it really sums it all up. Your ability to give informed consent is everything. What does that mean? It means you have to understand what they're doing, why they're doing it, and what the potential what-ifs are. A great therapist won't just treat you, they'll treat you like a partner in your own health.
So let's bring this all home. What's the bottom line? Dry needling can be a safe and really effective therapy for muscle pain. But, and it's a really big but, its safety comes down to two things: how skilled and knowledgeable your practitioner is, and how willing you are to ask questions and be an active part of the process.
And now I want to turn it over to you. Have you ever tried dry needling? What was it like for you? I'd love to hear your stories and what you think, so drop a comment down below. Let's get a conversation going. And that's a wrap on this explainer. Thank you so much for hanging out and watching. If you learned something new today, go ahead and hit that like button and maybe share this with someone you think should see it. And of course, make sure you're subscribed for more deep dives. I'll see you in the next one.